Hello, everyone, and welcome to today's Meet the Examiners webinar. My name is Rosie, and I'm an examinations administrator here at the Ophthalmology Foundation. Thank you so much for taking the time to join today's call. I would now like to hand proceedings over to David, who is going to run through some introductions and a brief overview of the Ophthalmology Foundation. Thank you, David.
Great, thank you. Well, good evening. It may be very late for some and maybe morning for others. So warm welcome to you all. I'm David Pyatt. I'm a co-founder of the Ophthalmology Foundation back in 2020. 6 years ago, I now serve as a vice president. And before I did this, I was chairman and CEO of Allergan, which you'll know is a very major ophthalmic pharmaceutical company for 17 years up to 2014. Since then, we've assembled a board of directors of really great stature. Most of the CEOs of the large eye care companies or the most senior executives of them, and many leading global ophthalmologists interested in training and education from literally every region of the world. I'm particularly delighted that one of our board members, Essam El Touki from Egypt, is attending today. And in the middle of the session, we'll ask him to give a few perspectives. Joining us today, we have also Luis Amaya, who's based in London. He's chair of the examinations committee. Unfortunately, Rebecca Ford is in clinic and will unable to be joining us today. So Luis will cover her section and Richard Bowman, who will cover the clinical ophthalmology section. Of course, beyond our board members and examination committee members, we have our staff led by Nicola Quilter, our examinations director, and you've already met Rosie and also Vicky Glossop. So getting into the meat of our session, first of all, I'll just cover what does the Ophthalmology Foundation do. We were founded 6 years ago. We, with the exams, initiated these in early 2025 in partnership with Wills Eye Hospital in Philadelphia in the United States and Wilmer Eye Institute. We are also partners with many regional as well as national ophthalmic societies around the world. So exams is one of our service lines. The next one I'd like to cover is fellowships. Here we're now offering almost 100 fellowships per year. Strictly speaking, they're observerships because, of course, with the host countries, really the main ones being the United States, Germany, and the United Kingdom, of course, you can't conduct surgery and it depends on the rules of the receiving country in terms of what forms of patient care you can be involved with. So 100 of those, we've doubled them in size, this program, which goes back into the early 2010s, started in Germany. And a very important part of today's session will be that to be eligible for the fellowships by September of 2027, so this is now, with 21 months notice, you'll actually have to have passed one of the sections of the Ophthalmology Foundation exams to qualify for one of these fellowships. The next service line is faculty development. This is all about how to be a better trainer or educator. Here in these programs, we're not trying to teach you how to be a better cataract surgeon or a better retina specialist. This is the how versus the what. And most of those programs are run concurrently with regional society meetings or other major eye care training events around the world. The fourth and the most recent program is accreditation. Here, various institutions around the world have decided they want to demonstrate to their service base and others that they're conducting residency training at the highest international level. So that's the fourth one. So summarizing, it's exams, fellowships, faculty development, and accreditation. But of course, for most of you listening today, the real primary question is, why sit the exams? Well, first of all, those that pass all the various sections that my colleagues will take you through will end up with a prestigious postnominal FIOF, a Fellow of the International of the Ophthalmology Foundation. At the highest level, of course, by conducting these exams and you passing them, we're strengthening training standards, and we're also improving patient care around the world. It's also a methodology to benchmark your knowledge against colleagues you have at a very similar stage in your careers all around the world. Very importantly, as candidates, these exams are high quality. They're the most recent questions and standards. They're low cost, and that's not because I just said high quality, not because we're trying to offer a low quality product. We want to make them accessible. And for this reason, we're typically about half the price of comparable global examinations in ophthalmology. We also have the benefit of these exams being sat online at host centers. There are now a network of over 80 host centers around the globe. And in recent sittings, if you've had a problem trying to find a local center, we've almost always succeeded in finding something in a major city in your country of residence. The exams, and I'm sure we'll cover this in the Q&A session, you do get exemptions if you've hitherto passed certain exams at the European Board of Ophthalmology, EBO, or you've passed COEXA, where we have a cooperation in Eastern and Southern Africa. The same would apply for Royal College's examinations in the United Kingdom, and also the International Council of Ophthalmology. So specifically, if you wonder if some of your exam passes qualify, that's a really good reason to write to us at the Ophthalmology Foundation, and we'll clarify your situation very quickly. I'm very pleased that we've delivered these exams in a very efficient manner. At the last sittings, Nicola Quilter and her team have been able to turn around the results to within 10 days of the actual exam sitting. And a final little piece of cherry on the cake, if you like, is for the top passing candidate, you're eligible for a $10,000 travel award awarded by my wife and myself, the David and Molly Pyatt Foundation, $10,000 to attend an international congress of your choice. So typically this would be, say, the SOE in Europe, or the AEO in the United States, could be the African Ophthalmology Council, or say APAO or the Pan American. So that really concludes my opening remarks. Hopefully this gives you a taste of what is to come. And I will now pass over to Nicola, who will take you through an overview of the different sections of the exams. Thank you.
Excellent. Thank you, David. And thank you everyone for joining today. Again, just a quick reminder that if you have any questions, to pop them in the box below, and we will come to a Q&A section at the end of everyone giving their presentation. I'm delighted to speak to you today about the exams, and I know David Pyatt's gone through some of the sections, but I'll just give you also an overview. And it's whether you're currently in training or planning your future career in ophthalmology, we hope today's session will help you understand how the Ophthalmology Foundation can support your professional development. Next slide, please. So at the Ophthalmology Foundation, as David said, our aim is simple, is to provide high quality examinations that are accessible to ophthalmologists around the world. Our examinations have been written by international experts and are carefully quality assured to ensure they assess the knowledge expected today of ophthalmologists like you. We've deliberately kept our examination fees affordable to remove all financial barriers wherever possible, and also introduce a 3- and 6-way payment plan that helps you spread the costs over that period. Because the examinations are delivered online, as David mentioned, through a secure exam portal in centres around the world, candidates like you also no longer need to travel internationally, making the exams far more accessible and affordable than ever before. They're high quality, low cost, and globally accessed. And these are the principles that we underpin in everything we do. Next slide, please. The Ophthalmology Foundation currently offers 3 core exams. The Visual Sciences exam, which consists of 120 multiple choice questions covered over a 3-hour period. And this exam assesses the scientific foundations of ophthalmology. We also have the Optics, Refraction and Instruments exam, which contains 60 questions over a 1.5-hour period and focuses on the optical principles and instruments used in clinical practice today. Finally, we have the Clinical Ophthalmology exam, which contains 160 questions completed over a 4-hour period and assesses the clinical knowledge required for modern ophthalmic practice. Together, these examinations provide a comprehensive assessment pathway that is recognised internationally. You're also pleased to know that there is no negative marking, so you'll not be penalised if you answer a question incorrectly. And what that does mean is, as there are 4 stems, you have a 25% chance of getting it right if you are making an educated guess. Next slide, please. The eligibility requirements have been designed to support ophthalmologists like you throughout your training. The Visual Sciences and Optics Refraction are open to qualified ophthalmologists, residents, and trainees. And after passing both, or if you're eligible through one of our recognised exemptions that David Pyatt mentioned earlier, you can progress to the Clinical Ophthalmology exam. Candidates who successfully complete the clinical exam become a Fellow of the International Ophthalmology Foundation, FIOF, and may also become eligible for progression to additional opportunities with our international partners. Next slide, please. So preparing for an examination can be challenging, which is why we've developed a range of resources to support you. Our IQ question bank, in collaboration with CyberSight, provide high quality practice questions written and reviewed by international experts. We also run regular webinars such as this, including examination preparation sessions and opportunities to hear directly from our examiners, as we are today. Candidates have access to recommended reading lists via our website and frequently asked questions, helping you prepare with confidence. Our goal is simply not to assess candidates, but to also support them through their learning journey. Next slide, please. So as David mentioned and touched on earlier, why choose the Ophthalmology Foundation exams? So firstly, they're internationally recognised and developed by leading ophthalmologists from around the world. The content is mapped into internationally respected BCSE curriculum and follows a rigorous quality assurance process. We have around 30 experts on our panel that will review each question that goes into our exam papers. Our examinations are computer-based and delivered through secure exam centres across multiple countries using AI and human proctoring, making them convenient and accessible. And using human proctoring and AI gives us a double layer of protection. Perhaps most importantly, they provide an internationally recognised benchmark, as David mentioned, and knowledge and a pathway towards FIOF, and with exciting opportunities continuing to develop through fellowship opportunities and the opportunity for the David and Molly Pyatt Award. Next slide, please. As David mentioned, one of our strengths of the Ophthalmology Foundation is our growing network of international partners. We collaborate with world-leading institutes, including Wills Eye Hospital, Wilmot Eye Institute, to advance ophthalmic education globally. We're also proud to work along national societies, including the Arab Board, the Egyptian Society, and the Turkish Society of Ophthalmology. And in addition, we're collaborating with COEXA on the visual and optics exams. In addition, we are currently in the final discussion stages with UK colleges, which represent another exciting step forward, creating international opportunities for candidates. All of these partnerships help ensure our exams remain globally relevant while opening new educational pathways for ophthalmologists worldwide. Next slide, please. Before I finish, I'd just like to return to the 3 principles that I defined earlier. Everything we build is around delivering high quality exams, keeping costs affordable, and ensuring you as candidates from every part of the world have access to our internationally recognised assessments. We believe geography should never be a barrier to professional development, and we're proud to be building a truly global exam programme that continues to grow each year. Next slide, please. Finally, before our experts, Louisa Mayer, who's covering also Rebecca Ford, and then Richard Bowman. I'd like to leave you with some important dates. Our application for the current exams closes on the 31st of July. The examinations themselves will take place on the 30th of September at secure computer-based examination centres near you. And if you go online and can't find a centre near you, then please contact us. And we have a 100% record of being successful, and we will find a centre near you. And if you're actually planning ahead to March 27, the exam sittings will open on the 1st of August, giving you plenty of time to begin your preparation and also use the benefit of our 3-month, 6-month payment plan. I'd like to thank you again for joining today. We hope to welcome many of you as our future Ophthalmology Foundation candidates. And if you have any questions, as I said before, please pop them in the box below, and we'd be delighted to answer them at the end of everyone's presentation. Thank you.
Thank you very much, Nicola. I would now like to ask Louise Mayer to please speak to us about our visual sciences and our optics, refraction, and instruments examination. Thank you.
So shall we get the optics talk, please?
Louise, we're going to start with visual, if that's okay.
Yes, no, with optics and refraction. Optics, refraction, and instruments. Great, thank you very much. Good afternoon, everyone. My name is Luis Amaya. I'm a consultant pediatric ophthalmologist working at St. Thomas's Hospital in London. I've been a consultant for 36 years now. I practiced for 10 years in Latin America and for 26 years here in the UK. I am the chair of the Examinations Working Committee of the Ophthalmology Foundation, and I am in charge of coordinating and building up the optics, refraction, and instruments exam. Next one. You already have been informed about these details, so I won't expand any further. Next one. So we have 3 exams, and I'm going to talk about the optics, refraction, and instruments. Next. As Nicola mentioned, this exam has 60 single best answer questions. It lasts 1.5 hours, and it covers 3 subjects: optics, refraction, and instruments. Next. So let's put this scenario. You are in clinic, and imagine you have a child who has been referred from the community because the child failed a vision screening test. The retinoscopy reflex is confusing, and you have just a few minutes to decide what's happening. Outside, you have 15 more patients waiting, and you have to be efficient, fast, and do the right thing for this patient. Remember, our mission is to provide the best possible visual function to our patients. And there's nothing more amazing than the gift of seeing. It's one of the most amazing senses. Next. So you are in front of this patient, and you don't know whether this patient has a refractive error, if this patient is short-sighted, long-sighted, if there's a cataract that explains the poor vision, if there's a malformation, if it's the cornea, if it's the lens. So in addition to doing a retinoscopy, you need to determine what else is going on, and you need a series of instruments to allow you to reach a diagnosis and treat the patient adequately. Next. So here, physics becomes a clinical scenario rather than just physics, optics. So remember, the exam is based on this principle that I just mentioned. It is not testing whether you can memorize questions or equations. It is testing whether you understand how light behaves when you're caring for patients. Vision is light, and light behaves in many different ways. So we need to understand that basic concept of how light behaves if we want to care for our patients adequately. Next. So, as I mentioned before, you can have a patient that is short-sighted and need a positive lens, or a negative lens, or is long-sighted and needs a positive lens, a patient with keratoconus who may need a contact lens, a patient with a refractive error that is older and may be benefiting from refractive surgery with laser, a patient with a cataract that needs a replacement of the lens with an artificial lens. All this involves optics. So in every patient that you are going to see as an ophthalmologist, an optics question is hidden behind somewhere. Next. And the same with instruments. As time evolves, we found ourselves with the most sophisticated and incredible and developed equipment that helps us treat these patients, reach very precise diagnosis, even come with the ability to detect diseases that they haven't even caused any symptoms. But we need to learn how these machines work, how to apply them in our daily clinical practice, what or how to use them, and also how to interpret the information that all these machines provide. So here is just a short example of different equipments that we use on a day-to-day basis during our clinical examinations and our practice as ophthalmology specialists. Slit lamps, indirect ophthalmoscopy, OCT, keratometry, contact lenses, intraocular lenses, retinoscopy, refraction, etc. Next. Now, who are the successful candidates? They are those who understand concepts, who are able of drawing ray diagrams and other kinds of diagrams. Candidates who are able to practice calculations and that they know the formulas, why formulas work, and how these formulas work. Next. And those candidates who are not successful is because they memorize equations or questions. They avoid optics until the last few weeks. Many candidates feel that optics has nothing to do with clinical practice of ophthalmology, when in fact is the basis of our daily practice. And sometimes candidates tend to panic when they see questions that may appear slightly different because they have a clinical application of a theoretical concept. Next. Remember, the exam rewards understanding, not memorizing. It's understanding. Next. So how to study? The curriculum is really vast and you can have access to the curriculum. But basically what you need to understand is the image formation in geometrical optics. So if you have a patient with astigmatism, how you correct this? What kind of lenses do you use? Spheres and cylinders, and where do you put the axis of the cylinder to optimize the way the rays come into the retina and the image is well defined and sharp? If a patient is long-sighted, short-sighted, as we mentioned before, if a patient needs an intraocular lens and whether this lens goes in the bag or is in the anterior chamber or is clipped to the iris, all these factors obviously are going to change the optics and are going to change how that eye functions, and you have to be aware of the basic concepts to be able to treat these patients adequately. Next. As far as clinical refraction, it's your day-to-day bread and butter. I've been at Consultas for 36 years, as I mentioned, and every day in my clinical practice, I'm refracting patients all day long. And it's something that I continue doing after all this time. So it's important that you maintain your refraction skills and to be able to sit the exam, practice, refract as many patients as you can, practice with your friends or colleagues, learn from senior colleagues, sit with optometrists in their clinics and get their advice and see the technique so that you have the basic concepts and you are able to prescribe glasses adequately to your patients. If you know all these concepts, you will do well in the exam. Next. And the same with instruments. As we mentioned, we need to know what the instrument measures, how it works, what it does, when we can apply it in our clinical practice, and how to read the results that these equipments provide. Next. So very quickly, I'm going to illustrate two examples of questions that you may find in the exam. This question says, which one of the following is the orientation of the streak of light when performing retinoscopy for astigmatism? So you have four options and you need to choose the right one. Think a little bit and try to decide which is the right one. Next. So we are talking about a streak retinoscope. You can rotate the streak to try to do an accurate refraction, and the way you do it is by aligning the streak with the principal meridians of the cornea, 180 degrees and 90 degrees if it's an astigmatism in that angle, or if it's at 30 degrees, you need to tilt the streak to 30 degrees to do the horizontal refraction, and the 90-degree change to do it. So it's a very easy question. If you know the concepts, you know the answer, and it's a day-to-day activity that you develop every day. Next one. This is the other question. For a patient with anisometropia, which one of the following is the primary concern that must be addressed when prescribing spectacles? The alignment of the optical centers, the potential for anisophoria, the risk of aniseikonia, the risk of inducing vertical diplopia. If you know your concepts right, and you know the effect of lenses in the images, then you know exactly which is the answer. Next. And obviously is the risk of aniseikonia. If a child is short-sighted in one eye, the lens, concave lens, will provide a very small image, while if the other eye is long-sighted, the convex lens will provide a very large image, and there's aniseikonia. It's something you need to consider when doing this. Next. And just three little concepts that will help you motivate to sit the exam. Nobody is born understanding optics. Every ophthalmologist now enjoys optics, once found it difficult. Who enjoys optics now found it difficult at some stage. The difference between passing and failing is rarely intelligence, and it is understanding the concepts, practicing regularly, and remaining curious. Next. Don't study optics to pass the exam. This is the most important advice. Study optics because it will make you a better ophthalmologist. Next. Just to finish off this little message, and try to remember this every day you wake up to practice ophthalmology. Optics is the language of ophthalmology. Once you learn that language, every instrument, every refraction, and every examination begins to make sense. Master the concepts, practice consistently, and the examination will simply become the opportunity to demonstrate what you understand. Thank you very much.
Thank you, Luis. Vicky, if you could share the presentation for visual sciences. Luis, if you wouldn't mind speaking us through that. Thank you.
So, yeah, let's put it first. So Rebecca is not here, so she asked me to give this short introduction on her behalf. Next. Rebecca is a consultant ophthalmologist based in Bristol. She's very, very busy and works really hard, but she's contributing with the visual sciences exam. As you are aware, it has 120 single best answer questions, and it lasts 3 hours. The subjects involved are anatomy, embryology and development, genetics, biochemistry and metabolism, pharmacology, imaging and digital ophthalmology, and ophthalmic pathology. Next. So this exam assesses the core scientific knowledge that underpins safe and effective ophthalmic practice. It is designed to ensure that candidates have a strong understanding of the basic sciences essential for clinical decision-making and progression in ophthalmology training. Next. As we mentioned already, the examination covers a broad range of subjects, including ocular anatomy, physiology, biochemistry, pharmacology, pathology, microbiology, immunology, genetics, optics, and visual function. The candidates are expected not only to recall key scientific principles, but also to apply this knowledge to clinical scenarios, demonstrating an understanding of how the basic sciences relate to everyday ophthalmic practice. Next. The question bank is developed by an international faculty of experienced ophthalmologists, educators, and subject experts representing a wide range of countries and healthcare systems. This global collaboration ensures that the examination reflects contemporary ophthalmic practice and is relevant to candidates regardless of where they are training. Next. All questions are written and reviewed through a rigorous quality assurance process, with each item mapped to the curriculum and scrutinized for scientific accuracy, clarity, fairness, and relevance. This collaborative approach ensures that the examination maintains a consistently high international standard while remaining applicable across diverse training environments. Next. I think that's it. The curriculum is mapped to internationally recognized standards and reflects the knowledge expected of ophthalmology trainees worldwide. The examination is designed to assess understanding, interpretation, and application of knowledge, providing a robust assessment of the scientific foundation required for a successful career in ophthalmology. Thank you very much.
Thank you very much for that, Louise. Thank you. I would just like to reiterate that we do have a chat box, a Q&A box at the bottom of your screen. So if you do have any questions throughout the course of this webinar, please feel free to drop them there, and we will come to them at the end. We also have all the questions that you did submit upon submission, so thank you very much for that. Richard, I would now like Richard Mobin to speak a bit about our clinical examinations, please. Thank you.
Hi there, can you hear me?
Yes, we can.
Great. So I'm Richard Bowman, and I am responsible for the clinical exam. I'm also a pediatric ophthalmologist based in London, but also have some international experience. I worked in East Africa for 8 years or so. So can I have the presentation for the clinical exam? The same general principles that Louise has been talking about here. With the clinical exam, we kind of see it as an exit exam to show that you're going to be a safe ophthalmologist. So again, we're testing not just your clinical knowledge, but we want to see some evidence that you've got experience of using that knowledge in practice. And I'll give some examples of that as we go along. We could have the next slide, please. And here's just the basic structure. Single best answer out of 4, no negative marking, and question overall. And that phrase, which one of the following is most likely to be correct, is the kind of recurring question. Next one, please. Here are the subsections that cover all the clinical subspecialties, really, and they're roughly equally distributed, apart from community and public health and general medicine, which have fewer questions. Okay, next, please. So I'm just going to give you some examples of how we try to test applied knowledge. Sometimes it's called secondary level knowledge as opposed to primary, with possible questions around Leber's hereditary optic neuropathy. So this first one is one that you would learn from a book. How does this disease present? And the answer, hopefully most of you know, is B. Usually sudden severe visual loss in one eye followed by the other in a teenager or young adult. So that's primary knowledge that you get from a textbook, and you need to know that. But we would be looking to go a bit further with applied knowledge. So next question, please. And we often give a clinical scenario. So here we're seeing, can you recognize Leber's hereditary optic neuropathy from the clinical scenario? And the slightly hyperemic disc is a characteristic feature of the acute presentation. Again, we've got the fellow eye following soon after, and the absence of an RAPD is unusual for an optic neuropathy and often seen in Leber's hereditary optic neuropathy. So we've taken you up a level there. Can you recognize it from a clinical scenario? And that would be a more likely question than the first one. And next one, we've gone up a level again with the next one. So here we're again asking you to recognize the condition from the clinical scenario, but you then need to use that and remember what the underlying genetics of Leber's is, which is a mitochondrial inheritance. So it's inherited through the mother, and it has a male predilection. So answer B, the maternal uncle is the most likely affected relative there. So that just gives you an example of kind of primary and secondary level clinical applied knowledge as opposed to just book knowledge. And that's generally what we're trying to go for. Here's another example. If we go to the next one, this is quite a difficult one. I think this has come out of the exam now, but it does illustrate again that you'd need to have some experience to be able to answer this question. So this is a fluorescein angiogram which shows peripheral closure of the vessels, and that is what you see with retinopathy of prematurity. You see poor vascularization at the periphery of the retina, but if you've done any ROP or pediatric ophthalmology, you know we don't do fluorescein angiogram at 18 months for ROP, so that's going to be the wrong answer. Family history of Best disease. Best disease is a maculopathy, so that's not appropriate. And unexplained poor vision. We don't generally do fluorescein angiograms in 18-month-olds we would do other investigations. So again, you would need to know what diseases cause peripheral retinal vascular closure in infants. And one of them is incontinentia pigmenti, and that presents with a pigmentary skin rash. And so the correct answer is A. So again, that shows you need a bit of experience and applied knowledge. That's quite a difficult question. And we go, every time we do the exam, we go through and we look at not only how difficult are questions and how many people are passing them, but we look at how reliable each question is, in that how do the responses vary between candidates who are scoring well overall in the test versus candidates who are scoring poorly overall in the test. And we see how each question compares there to tell us how reliable it is. Have you got the next slide? Just go on again. We'll come back to that one. Next one. Yeah, so we do these quite complex analyses, or our statistician does, to show us how reliable each question is and how difficult it is. And we try and improve the exam each time based on that feedback. Now just go back again to the last slide. I just wanted to put in one example from the community eye health, because I think that's an area where many of us as ophthalmologists don't know that much about, because we don't deal with it on a daily basis in our clinics. And so an exam tip is just to revise some of the most important figures around how many people are blind globally, and to read some material on community eye health, global eye health, because there's quite a big section on that, and it tends to be one where candidates are weaker. Okay, let's go on again. The answer is B there, by the way, if you're wondering. And again, yeah, and again, yeah, that's just the statistics that I was talking about. And again, in terms of revision strategy, apart from that tip about global eye health, I think three things. You do need to know the basic textbook knowledge, and our curriculum loosely correlates with the American Academy Basic Science and Clinical Science series of textbooks. Kandinsky is another good broad textbook, which candidates who are, say, revising for the FRC Opt clinical exam, which is a similar standard, would look at in the UK. So those are good places to start. Then some experience in MCQ exams, which you'll have had from doing the other parts. But there are textbooks out there with practice MCQ tests for clinical ophthalmology, which are useful. And I guess you could use AI even to generate MCQ practice questions for yourself in these different areas of clinical ophthalmology to practice MCQ technique. And then finally is the one that we've all been saying all the way through, is which if you've just been learning from a book or AI, you won't pass. You need to have had a good degree of clinical and surgical experience. The cataract questions will include questions that will distinguish between those of you who've actually done cataract surgery and those of you who've just read about it. So the idea of this exam is that you should be, if you pass it, you should be ready to go on to a face-to-face exam with your local accreditation board and be ready to become a consultant ophthalmologist. And that's it, I think. Is that my final slide? Yeah. Thank you very much.
Thank you very much, Richard. I'd now like to welcome our board member, Essam El-Touki, to say a few words on why trainees should take the Ophthalmology Foundation examinations. Thank you.
Thank you. Hello, everyone, and good luck in your attempts for the Ophthalmology Foundation exams. As my colleagues have just mentioned, it's a standard exam. When you take it, everybody will know where do you stand, and this is very important now in our modern society with all the globalization. It provides an idea, a level that we know that is the minimum competent level. I'm much involved with the clinical exam more than the visual sciences and the optics. And as Richard said, we are looking for the safe consultant or becoming a consultant for a competent. And by competency here, we mean clinical competency, not just bookish or bookworm candidate. The scenarios that we are going to present in the exams are all true clinical scenarios. We don't sit and make up clinical scenarios that are not present. So we always say that if you want to pass these exams, spend more time in the clinic rather than reading the book. Books are important, knowing the basic knowledge is important, but to become a clinical competent consultant and to pass the clinical exam, we need to understand and make sure that your way of thinking will be safe for the patient, will be safe for the community. Regarding the questions, most of them are clinical scenario questions, true clinical scenario questions. Even after the exam, standard setting procedures are used, again, as Richard just pointed out, to make sure that no question was way too difficult or even way too easy, that it really reflects true knowledge, and that if you have answered it correctly, you really are answering it correctly with very less a chance of guessing. With the new collaboration with the Royal Colleges, with the Arab Board, the Egyptian, the Turkish, the Kuwait, we now put you, if you graduate and pass the exam, at a level that everybody will really understand all over the world. I've been an examiner for more than 25 years at the Royal Colleges, at the Arab Board, the Egyptian Board, all the Middle Eastern Board, and having such an exam was always something that we were looking for. It provides an accurate, a valid, a reliable way of telling to the people, to everyone, that you are now a competent and will be a competent and safe consultant. The more you practice, the more you spend time in the operation room, the more you spend time in the clinic, the less easy will the exam be. And this is very important. We are not asking you to memorize books anymore. Practice some MCQ questions and do more clinical work. Thank you. Good luck.
Thank you very much, Essam. We can now proceed with the Q&A section of the webinar. Vicky, I believe you have some questions in front of you to delegate. I'll hand over to you. Thank you.
Thank you, Rosie. We've received quite a high number of questions. The first question we have is for Nicola. If you were to advise somebody sitting the examinations for the first time, what are the 3 most important things they should focus on?
Thanks, Vicky. I think one of the main and the most important things is make sure that you're prepared. So make sure that you access all of the materials that we offer. Make sure that you have enough time to prepare. So we know that you've got commitments and you've got families and work and hobbies, etc. So make sure you give yourself enough time. And our recommendation for the September exam, for example, our application process closes at the end of July. And we believe that then from that point you have enough time to prepare. So that's the first one. I think make sure that you apply early. I think the earlier you apply, it's also part of your preparation, but then you also have access to our 3-way and 6-way payment plan. And I think the third thing is obviously use us as well. So, contact us. You have access to these webinars with Richard Bowman and Louise Mayer, Rebecca Ford, David Hyatt. Access that and make sure that you're equipped and that you're taking the right exam. Also look to the future as where you want to end up. Do you want to move down a certain pathway, once you've taken our exams, and use our exams as a stepping stone. to making sure that you're reaching your milestones and your highest target.
Thank you very much. The next question we have is how can they access study materials and the QI bank, sorry.
All of that information can be found on our website. And Rosie, if you can put that into the link at the bottom, please, so you can click and access it there. We have actually questions on the website, practice questions for each of the exams. So you can go on and get a feel of, what type of questions we're asking, how we're asking them, how to answer them. The IQ Bank is links through our website, but also Cybersite, and our suggested reading list is accessible again through our website.
Thank you very much. The next question we have is how do I register for the Ophthalmology Foundation examinations? Nicola, if you could answer.
So our process is quite seamless. You can access the applications form through our website. You log on, set up a portal that will include information about yourself, where you're training, qualifications you've met. We'll ask you to upload a photograph, passport photo of yourself, and then you can apply for any of our exams through that portal. It will also allow you to make payment through the portal, and then again, that's where your results at the end of completion of the exam will be uploaded. And I think, as David Hyatt mentioned earlier, the turnaround of our results are within 2 weeks. Credit to Rosie and Vicky for March this year. We were releasing results within 7 days. And I think, we understand the stresses and that causes. You're worrying whether you've been successful. So the results are turned around quickly and they will be uploaded again to the portal. So from start to finish, you'll see a smooth process of application.
Thank you very much. The next question we have, I will direct to David Hyatt, please. What are the benefits of passing the Ophthalmology Foundation examinations and becoming a fellow of the International Ophthalmology Foundation?
Yeah, I think I covered that probably in quite a lot of detail, but my comments were reinforced by Dr. Al-Tuki, for example. This is a great way to benchmark your knowledge versus peers all over the world who are at a similar point in their training and advancement. So let's go to the next one.
Thank you very much. The next question we have for Nicola, please, is why take the OF examinations? Are they the same as the ICO exams?
That's a great question. So I think rather than sitting here saying we're better, I'll get our strengths to speak for themselves. And I'll take you back to the slide that I showed in my presentation, is that we're high quality, low cost, global access. Those 3 principles underpin everything we do. And I think the Ophthalmology Foundation provides international developed high quality exams that are affordable and accessible to ophthalmologists around the world. So I think that's what makes us stand out.
Thank you very much. The next question we have is it possible to sit the optics, instruments and refractions examination without first completing the visual science exam?
Another good question. Yes, you can take the optics and refraction if you are a qualified doctor. And lots of people choose to start with that because it's a smaller exam, it's 60 questions. It kind of gets you, gives you a feel of what we're about. And then obviously you would have to then pass the visual sciences before you can move on to our clinical exam. So the answer is yes. A lot of trainees take visual and optics together. And do it that way, so in the same sitting. If you're successful in one and not the other, then you can then retake the next one in your next sitting along with clinical, for example. We never release a clinical certificate until visual and optics are fully passed.
Thank you very much. The next question we have is, should a candidate choose to sit the OF examinations or the ICO examinations, considering they're comparable?
Another great question. So I think ultimately that it's a personal decision, but I'll explain why candidates choose the Ophthalmology Foundation. As we've said before, we offer high quality international developed exams, low cost fees, global access through secure computer-based testing centres. So they're online, they're not written on paper. Candidates also benefit from comprehensive preparation resources, which we discussed, the IQ, the webinars, reading lists, frequently asked questions, as well as higher fellowship opportunities through the OF. Successful candidates get FIOF, so you become a fellow. We've got global ambassadors. So if you're a top passing candidate in clinical, you'll be invited to be a global ambassador for the OF. And I think combined with our growing networks of international partners, the OF supports ophthalmologists through your personal development. So I think that's why I would choose the OF.
Thank you very much. We have a question for Richard Bowman, please. Which topics are most heavily tested within the clinical exam? Richard, you're on mute, sorry. Thank you.
Could you just put that slide up again of the clinic? Is it easy or not? I mean, there's 17 questions on the 8 subspecialties: neuro, peds and strabismus, adnexal, cornea, uveitis, glaucoma, and cataract and retina. So we try and keep it balanced between all of those, and then there are slightly shorter sections on community and public health and general medicine related to ophthalmology. And although those are shorter, I think those are ones where we tend to be weaker as ophthalmologists. So do pay some attention to them in your revision. As I mentioned before, just have a rough idea of global numbers of visual impairment and blindness and causes, and a little bit of an idea on very basic epidemiology, what trial methodology and things like that, which are important for you to be able to evaluate evidence in your future careers. And likewise, general medicine relating to ophthalmology should come with clinical experience, but take a look at those sections of whatever textbook you're using a bit.
Thank you very much. The next question we have is for Nicola. How many months of preparation is typically recommended?
As I mentioned earlier, our closing date, for example, for the September exam is the end of July. So we believe that you should, be able to apply at the end of July and have enough preparation time for the September exam, which is on September the 30th. However, as I said, you need to make sure that, you do set aside enough time to prepare. And we understand that everyone has commitments, family, etc. So just set aside enough time for yourself and don't put too much pressure on yourself. If September's feeling too close, then obviously you can apply from the 1st of August for the March exam. So again, apply on the 1st and prepare yourself for March. So yeah.
Thank you very much. We have a question I'd like to direct to Samuel Tukey, please. What advice would you give to trainers and teachers preparing candidates for the examinations?
Very good question, actually. First, to train them well, because this will provide them with confidence to test their knowledge and their practice frequently during OPD time, during operation room, to keep discussing and talking with them and showing them the cases, even the straightforward cases, because, by the way, most of the exam will be straightforward cases. We're not looking for the rarities. We're not looking for cases that you would only see once in your lifetime. This does not make the good, safe, competent consultant. It's the usual everyday practice cases that makes the good, safe, and competent consultant. So as trainers, the more duties, the more responsibility, the more confidence and reliance we give to our trainees, the better candidates and the easier for them to pass the exam.
Thank you very much. The next question we have is, if I fail an examination, how soon can I retake it? To Nicola, please.
Well, our exams are held in March and September. So if unfortunately you're not successful in either one of those, then you can apply for the next sitting. Application process is open straight away. So if you get your results and haven't been successful, then apply for the next exam. Ample time again to prepare and use our reading lists and material, etc., and take benefit of the payment system.
Thank you very much. The last question we have at the moment, unless we get any more come through, is what are the exemptions available to candidates if they've passed ICO, EBO, COEXA, etc.?
Yeah, so we do have an exemption policy, and that is from our visual and optics exam. We exempt those that have been successful in the COEXA exams, visual and optics, and also the ICO exams. ICO are up until 2022 inclusive, and then after that, we're unsure of the standard of those exams. So if you've been successful with ICO up until 22, then we'll exempt you from our visual and optics. We exempt those that have taken the college exams in the UK, along with EBO. So you will be exempt from our visual and optics. You will have to pass our clinical exam to be able to use FIOF.
Thank you very much. We just did one more question. Is the result a pass or a fail, or do you get a numerical score?
So you will be awarded a pass or fail. You will also be given your score, so your total, and that will be uploaded to your portal. We also issue merits and distinctions for our top passing candidates. So you'll either receive a distinction, merit, pass, fail.
Thank you very much. We have questions regarding exam fees, but as they're based on the World Bank Index, that we can get them to email us directly, I think. If Rosie could put our contact details up, please.
Yes, I've already shared them into the chat box.
Thank you very
Thanks.
much. That's all the questions for today. Oh, Essam, do you have a question?
I just need to clarify that the certificate, when you pass the exam, I don't think it will have a score. It will say that you have passed the clinical or the optics exam, correct?
That's correct. They'll get a score sheet that's uploaded to their portal, which will tell them whether they've been successful or not, along with their score. So they will get that information. Their certificate is a really high quality certificate, embossed, logo, hologram, etc. Which is really proud, once you're successful, to put on your wall.
Sure.
But yeah, it won't have the score on the certificate.
I just want to clarify that the score will be personal, correct?
Yes, totally personal on their portal.
Yes.
Thanks, Essam.
Thank you then, Rosie. That is all the questions we have.
Thank you, Vicky, and thank you everyone for joining us today. Just to say again, I have shared our contact details in the chat box. So if you do have any questions for the examinations team, please feel free to reach out to us at any time and we will help you with any questions or concerns that you may have. I would now like to invite David Pyatt to deliver the closing remarks. Thank you.
Great. Well, thank you, all of you around the world for attending. Thanks for interest. I think you can tell from the questions, people are really evaluating how to do this. And I think my colleagues on the clinical side have really done a great job letting you know that this establishes you in your local community as an extremely competent ophthalmologist. And that's exactly the goal that we share with you. So I'd like to add to Dr. El-Touki's remarks, just wishing you every success.
Great. Thank you very much, everyone, for joining again. We have this session recorded, so we will send it out to everyone who has registered. And we look forward to hearing from you soon about our examinations and helping you in your journey with the Ophthalmology Foundation. Thank you all. Goodbye.
Thank you. Bye.
Okay, thank you. Bye.